Now, the European Medicines Agency on Tuesday said that the Omicron variant is pushing COVID-19 towards being an endemic disease we can live with. The less severe variant is currently raging across the world, with the WHO estimating that more than half of all new infections in Europe will be Omicron in the following weeks. So in South Africa, almost 6,800 new cases were logged in the last 24 hours, with a 15.5% positivity rate. Another 181 people succumbing to the virus in that period. Dr. Michelle Groome is the head of public health surveillance and response at the National Institute for Communicable Diseases. She joins us now via our video link. Dr. Groome, it's great to talk to you, as always, here on the program. You know, this briefing that was given by the European Medicines Agency on Tuesday, this announcement that was made, is this some light at the end of the tunnel for us around the world insofar as the pandemic is concerned?
No, definitely. And I think it's not new thinking, and it's not just their thinking. I think, even after the third wave, a lot of our thinking was that we would, need to start, looking towards how we deal with COVID-19 as an endemic disease. And what that really means is that, it's unlikely that COVID-19, it's not going to disappear. I think the SARS-CoV-2 virus is going to stay in circulation. But it's going to, as more and more people become immune, either through natural infection or through vaccination, there should be less transmission of the virus, and we will have some underlying immune protection, and so less severe disease. And we've seen this with the fourth wave, which was fueled by Omicron, where although we saw case numbers which are much higher than what we'd seen with previous waves, our hospitalizations and especially our deaths were much lower. And so that's an indication that this virus is moving towards becoming endemic. And an example of an endemic disease would be influenza, where, we see every winter there's increases in the numbers of influenza. Some seasons we have a slightly more severe flu season, but flu continues to circulate. There is some severe disease. But basically, it means that the virus and the humans will kind of live together.
A very different picture that we're seeing as a result of the Omicron variant here in South Africa and in other parts of the world, where a similar scenario is unfolding. As you say, more cases than we've seen in previous waves, but fewer hospitalizations, and according to the research, fewer deaths, fewer excess deaths as well. But a very different picture in other parts of the world. Europe was one of them.
Yeah, so I think we were just really at the beginning of the Omicron, and we're really the first country to see these very high increases in the number of cases. And I think, the patterns are not that dissimilar. I think, Europe and the US are doing far more testing. So I think we know that the numbers of cases that we saw is really a gross underestimate of the true number of cases that we actually had, in the fourth wave and even earlier in the pandemic. And, and we estimate that at least, we're only picking up at least 1 in 10, of every COVID-19 infection. And so it is a similar pattern. I think the UK also looks, they saw very high case numbers, but do seem to have turned and are coming down. And I think one of the differences is that, we were at a very low level of COVID-19 infections before our fourth wave, lower than, at the lowest point since the start of the pandemic, where, the rest of the world, Europe, the US, was very much still in their Delta wave. And so they, had, Omicron now on top of Delta. And so a slightly different pattern. We, a lot of South Africa was infected with Delta wave. We have a lot of underlying, infection, immunity to infection through natural infection and vaccination. So I agree we can't really translate different countries, but I think we're definitely, ahead in terms of what the other countries could potentially expect.
I mean, on the same token, from what you're saying around other countries are perhaps testing more, the same is true for our cases that were discovered here, and many of them were discovered actually incidentally because people were not showing symptoms. They may have been in hospital for completely unrelated issues, and only then their COVID-19 positive result was detected.
Yeah, and I think that's part of the new thinking. We almost have to have a bit of a paradigm shift in terms of how we're looking at COVID-19. And, for other diseases, we don't test asymptomatic people for diseases. And so I think we do need to start looking at how we approach and, that we're testing for COVID, because of clinical management. If people are ill and they present with symptoms suggestive, we'll do a test. And to try and move away from a lot of this testing of kind of asymptomatic individuals. Because I think you're correct. What we saw with hospitalizations, was a lot more, people who had gone in for, some routine procedure, had to have a COVID-19 test and then tested positive. And I think what our testing numbers, are kind of a combination of people testing for traveling, incidental cases, as well as the more severe disease, and sometimes a little bit difficult then, to unpack what's really happening. So I think in future, monitoring more the severe disease is going to be a better way forward.
And how are we doing insofar as people who are developing severe disease as a result of COVID-19 under the Omicron variant? Because, it's perhaps not comparable to other months in the pandemic, but the numbers of people that are dying are still quite high. I think, Dr. Groome, you'll correct me if I'm wrong, overnight 181 people succumbing to the virus. Is that still incredibly high?
Yeah, look, everything's relative. I think we've become, from seeing very high numbers of deaths in our Delta wave, I think you become almost thinking, oh, well, the deaths are lower. But I agree. Every death is still a death and is important. And I think what we've seen is that, around 80% of our hospitalizations are in the unvaccinated. And so we can definitely try and, bring those numbers of hospitalizations and deaths, down further by encouraging vaccination. And vaccination even in people who've had COVID. I think there's studies coming out really showing that our immune system and our immune responses are really boosted by vaccination, even if you've had a COVID-19 infection. Yeah. So I think we need to get up, those vaccination rates. This last wave really showed a movement towards more disease in the younger populations, which I think, were less likely in previous waves maybe to be infected, and the vaccine coverage is lower. So I think we can definitely, the elderly who are kind of at high risk need to get their boosters, and we really need to encourage everyone to vaccinate.
Yeah. So what does this mean, Dr. Groome, as we wind down our interview? The story that we're leading with when we started our interview, that COVID-19 will become endemic like the influenza virus as well. What would be the implications of that for those non-pharmaceutical interventions like washing of hands, like wearing of masks? Do you see us in the coming months walking around, heaven forbid, unmasked?
Yeah, I think it's difficult to put a timeline to that because, I think it depends on a lot of things and, how long our immunity lasts, how quickly we push our vaccination rates up. But I think, there would be an end. I think we definitely at this point, even now, need to really have a look at what interventions are working. I think when we started out, we didn't know a lot about the virus. We know a lot more. So things kind of, we thought in the beginning there was a lot of spread by a surface. We didn't think it was spread by aerosol. So I think those things we have a lot more data on. And so I think we need to really reassess, the kind of deep cleaning and sanitizing is maybe not as an effective measure because most of it is spread by aerosol and by respiratory spread. And I think we would slowly be able to kind of move away, from some of these restrictions. I think the really positive thing is that, we've managed to get through the worst of this fourth wave without having to increase our level of restrictions. And I think that's really positive and something we mustn't forget that, the third wave was a big wave, but in the face of even having restrictions where we haven't. So I think that's really positive that we would eventually start, moving towards more normality. And I think just, maybe being able to do away with some of these interventions slowly, but difficult to kind of give an exact timeline. But I think positive steps towards it.
From pandemic to endemic, Dr. Michelle Groome, NICD's Head of Public Health. Let me thank you for your time this morning on the AM Report.